If your shoulder pain is worse at night, if you're waking up at 2 a.m. in the morning and you can't find a comfortable position, you're exhausted on top of being in pain, then this video is for you. Nighttime shoulder is one of the most distressing parts of this condition, and it's one of the first things that I address with every patient that comes in the clinic. There are specific reasons that it's worse at night and specific things that can help. Let me walk you through them. Hi, I'm Dr. Moss with Moss Rehabilitation Center. In my 28 years of experience in treating shoulder patients, these are some of the top tips that I've given my patients to help them get a nice restful sleep and feel better in the morning. So why does your shoulder pain spike at night? Well, people always ask me, why is it so much worse at night? Well, here's a couple of reasons. One, no distractions. When you're up busy on the day, you're doom scrolling, you're getting dopamine hits, you're looking at your phone, you're busy, you're working, you're driving, your brain is distracted. Not so when you lay down. When you lay down, everything starts to come to fruition, and all of a sudden those pain signals that have actually been there during the day, they're more conscious on your mind and you feel that pain. It's neuroscience. Two, gravity's gone. So the position of the shoulder with your arm hanging here, it affects the tissue a little bit differently versus laying on your back or laying on your side at night when you sleep. It can change the composition or the fluid movement, and it can cause that inflamed tissue to now have a little bit more fluid or pressure on it, which can also increase the pain signals that you start to experience. Number three, inflammation tends to peak in the earlier hours of the morning. So there's a circadian rhythm to the inflammatory markers in your body. Typically, that peaks around 2 to 4 a.m., which is a common wake-up period that most patients report. And four, compression from laying on the shoulder. So direct pressure on the inflamed bursa, injured shoulder, rotator cuff, even just the body weight is enough to cause those pain signals to become a lot more noticeable. So the sleeping positions that actually help are, one, use a pillow to help support your arm as you're laying on your back. You have a pillow to support your scapula from rotating and falling backwards, and also prevent your arm from going back too far when you're laying down if you are a back sleeper. If you're a side sleeper, use a pillow to kind of hug that pillow to prevent your shoulder from rolling all the way forward in the middle of the night. That'll also prevent you from tossing and turning too far forward. The other is you want to avoid sleeping on the affected shoulder. Even though it may feel good at first, that constant pressure on the joint is going to irritate the tissue and make the pain increase even more. The other thing you want to avoid is trying to sleep overhead. We want to avoid that because that's going to cause compression within the subacromial space here, which it has the bursa and the rotator cuff tendons. That'll actually make the pain even worse, even though it might feel better to start with. So try to avoid sleeping with your arm overhead. So what to do first thing in the morning when you wake up? Don't reach for the medication. Don't reach for the ice. We want movement. So three simple things you can do. One, we can do the pendulum exercise. You're going to let your arm hang at your side and just dangle as you gently move it around for 2 to 3 minutes. That'll help open up that subacromial space and change the pressure in the joint. Number two, a gentle external rotation stretch. You're moving your arms out to the side, which is getting the rotator cuff activated. And number three, scapular retraction. By retracting and pulling your shoulder blades backwards, that actually opens up the subacromial space to help reduce pressure on the rotator cuff tendons and the bursal sac. One other point, don't just lay in bed, think it's going to get better. We want you to get up and get moving. Gentle movement is going to be better than being still for most conditions, and your shoulder condition is no different. So nighttime shoulder pain often improves significantly with just a few changes in how you sleep. Use those points, modify how you're sleeping, and support your shoulders. If these strategies aren't making a dent after 2 weeks, then that's a signal that the underlying condition needs a little bit more direct treatment. So I'd encourage you to talk to your physical therapist or your doctor about your shoulder pain. Okay, you deserve to sleep through the night, and this is fixable. There's many things that we can do. These are a couple of points that have helped my patients tremendously over the last 28 years. So, which shoulder hurts? How are you sleeping? And what are you doing to try to get a better night's rest? Make sure you comment below, and I'll see you on the next video.